Hello, thank you for joining us today for a special presentation in recognition of American Heart Month. The power is in your hands, understanding CPR and AEDs. My name is Gina Ora, and I am the Physician Liaison at McLaren Bay Region. During today's broadcast, as questions come up, please feel free to enter them in the comments section, and they will be addressed at the end of the presentation. Today, I have the honor of introducing Danielle Jean, the Emergency Department Nurse Manager at McLaren Bay Region. Welcome, Danielle.
Hi, Gina. Thank you for having me today. Today, we're going to be talking about CPR. It's something very commonly used in general public, but not everybody is aware of how to do it or when they should do it. So just some quick facts for you starting out is there are over 1.5 million heart attacks that occur in the US every year. And 20% of those patients, unfortunately, don't make it to a hospital. That's 300,000 people annually that don't survive because they couldn't make it to an ER in time, or somebody couldn't initiate CPR right away. The most recent data supports that cardiac arrest is becoming the #1 cause of death in the US. Statistics show that the earlier CPR is initiated, the greater the chance of survival. And those survival rates actually double if they're initiated within the first 4 minutes of a person going down. So cardiac arrest. Cardiac arrest is when the heart suddenly stops beating. When the heart's not beating, that causes a lack of blood flow to the brain and other vital organs, which are necessary to survive. It's a medical emergency, and immediate intervention is absolutely necessary in order to prevent death. People often mistake heart attacks and cardiac arrest to be in the same thing. Fact is, they are very different, but one can lead to the other if untreated. Heart attacks, they occur when blockage of the arteries cause straining on the heart or decreased blood flow to the heart. Cardiac arrest occurs when the normal electrical activity of the heart is interrupted or suddenly stops. There are many causes of cardiac arrest. The one thing that is evident is a heart attack left untreated that is severe enough can absolutely lead to cardiac arrest. So what do you do if you find somebody in cardiac arrest? The simple answer to that is CPR. Stands for cardiopulmonary resuscitation. Cardio means the heart, pulmonary means your lungs, and resuscitation means revival. So it's a common technique used to help a person whose heart stops beating or they're in cardiac arrest. It's a simple 2-step process that anybody can do, and involves chest compressions, which is you artificially beating for that heart, and rescue breathing. One thing that is new evidence-based practice is that hands-only CPR is absolutely acceptable and very much effective. So the first thing you need to do if you find somebody who's down is stop and take a look at your surroundings. Make sure that you are safe to intervene with that person and that you're not putting yourself at any risk. Try to determine what happened, why is that person on the ground, and are there any hazards around here or anything that could potentially harm me by intervening. Only approach somebody if you feel that it is safe for you to do so. So step 1, you're going to check this patient for responsiveness. Are they awake? Are they unconscious? If they're unconscious, try to wake them up. Tap them on the shoulders, shout their name. Sir, sir, are you okay? Ma'am, ma'am, are you okay? If they don't respond to you, you want to yell for help, grab an AED, and call 911. Next step you're going to do is you're going to assess that person. First things first is you're going to open the airway. Then you're going to look, listen, and feel. What you're going to do after opening that airway is you're going to look for chest rise and fall, which would be indications of breathing on their own. You're going to listen for breath sounds by putting your ear close to their mouth, and you're going to feel for a pulse, which is you can do right on their neck or even by their wrist. Next thing you need to remember is, did you call for help? If you haven't called for help yet, do so at this time. So the American Heart Association and the American Red Cross guidelines now initiate CAB, formerly known as the ABCs of CPR. Currently in practice now, we are utilizing circulation revival before we go to airway and breathing. And the research is showing that there is enough oxygen in the bloodstream to maintain the heart and brain even after studying cardiac arrest, meaning that the person was breathing before they collapsed, and that you should just start circulating that oxygenated rich blood immediately. Airway is going to be your next step, where you open the airway, and that is absolutely essential in order to provide effective rescue breathing for that person. Breathing is the rescue breaths, and it's going to just help provide more oxygen to the bloodstream that you're going to circulate through with those chest compressions. So the third step you're going to do is initiate CPR. So CPR, the chest compressions. You're going to have your hands, 2 hands centered on the chest, and you're going to go right on the sternum, which is the hard plate in your chest, right between the nipples. You want to keep your body positioned centrally over that patient. You want to lock your arms and elbows to keep them straight. That way you're giving good, steady compressions each time. You want to press down about 2 inches at a rate of 100 to 120 per minute. And it's very important that you allow the chest to return to its normal position before you push down again. That allows the heart to fill with blood before you pump it back out. One way to remember the rhythm and a way to give good, adequate chest compressions is thinking of the 1977 disco from the Bee Gees, Staying Alive. The chorus is perfect for the beats required to maintain that 100 to 120 chest compressions a minute. And believe it or not, it is actually used in real-time training for medical professionals on how to give adequate CPR. So rescue breathing is the next part of CPR. You can do mouth to mouth, which is when you would pinch the nose and put your mouth over the patient's mouth and give rescue breathing. And if there's trauma to the mouth or you're unable to open their mouth, then you can do mouth to nose. You're going to give 1 breath over 1 second. You're going to look for that chest rise and fall, and then you're going to wait 5 to 6 seconds, and you're going to give another breath over 1 more second. After that second breath, you're going to get immediately back on the chest. That is to help circulate that oxygenated blood through the body as quickly as possible. The standard for CPR is 30 chest compressions followed by 2 rescue breaths, and you continue that cycle until an AED arrives and until help arrives, such as EMS or first responders. The AED. A lot of people are familiar with what an AED is, and it stands for an automated external defibrillator, similar to what's used in ambulances and emergency departments. An AED is a small device that will automatically determine the heart rhythm of a pulseless person, and it will defibrillate them or shock them, their heart, in an attempt to restore its rhythm back to normal. When used in the first 3 to 5 minutes of cardiac arrest, it has been shown to increase a person's survival rate significantly. So the ABCs of an AED. It's a very simple, easy process that anybody can do. Step number 1 is you're going to power on the AED. Step number 2 is you're going to attach the 2 electrodes, which are gel pads. You're going to put 1 on the right upper chest of the patient, and you're going to put 1 on the left side of the patient on the rib cage. Step number 3 is it's going to say analyzing. At that point, you're going to step off the patient, stop CPR, and let it analyze their cardiac rhythm to determine if a shock is necessary or not. If it says shock advised, the big button in the middle, no matter what type of device you're using, it's going to flash and it's going to set off a loud alarm. You want to press that shock button. So how to use an AED in cardiac arrest. You find somebody down, you're the person doing CPR, somebody else runs up and they have an AED and says an ambulance is on the way. You are going to continue doing CPR, keep doing those chest compressions, and that other person who brings the AED, they are going to help apply that. It's a very simple 2-step process as well. You turn the AED on, you attach the pads, and that's it. It will do everything else for you. It will walk you through a step-by-step process. Like I said, when it says analyzing, you're going to stop CPR and it's going to analyze. One of 2 things is going to happen at that point. It's going to say no shock advised when you would get right back on the chest and continue doing compressions, or it will say shock advised. When it says shock advised, it's very important that you stop CPR and make sure that nobody else is touching that patient. Once everybody is clear of that downed person, then you hit the shock button and it will defibrillate that patient. After that shock has been delivered, make sure you get right back on the chest and continue CPR. So AED safety. Rule number 1, don't ever touch the patient while it's analyzing because it can interfere with the rhythm that it's actually interpreting. Number 2, don't touch the patient while it's shocking because there is potential for you to be shocked as well, which puts you at harm and at risk. Number 3, do not ever shock anybody who is near flammable materials or somebody who is wet or lying in or near a body of water. At this point, you've been doing CPR, you gave first aid to that person who was down, paramedics are on scene, and they are going to take over from there. The important thing is CPR and early defibrillation with an AED is very proven to give a person the absolute highest chance of survival after cardiac arrest. The neat thing with AEDs is they are located in almost every public building, such as schools, churches, libraries, and a lot of your local businesses as well.
Okay, thank you, Danielle. So much great information. Great information for our viewers. I understand that you will now be demonstrating the proper techniques you discussed in your presentation when using CPR and AEDs. So that will be something that we would like to watch.
Okay, so this is going to be my downed person. So first thing I'm going to do, I already determined it's safe for me to approach the patient, is I'm going to go up and assess the patient. Are you okay? I'm going to scream, I'm going to shout, I'm going to grab their shoulders, tap them on the chest. Nobody's responding, so now I want to check and see, are they breathing? To do that, you have to open the airway. And what this does is this displaces the tongue from blocking off the airway when it's in a neutral position. You want to put 2 fingers under the chin and your hand on top of the forehead, and you want to lift slightly back. And what that does is that gives you the maximum airway potential. So you're going to look, listen, and you're going to feel for any breathing. You're going to look and see for chest rise and fall. And then you're also going to feel for a pulse. And to do so, you're going to put 2 fingers on the side of you're going to feel right down by their Adam's apple. And you're going to go right at it. And if you feel a pulse, that's good. If you don't feel a pulse, don't panic, but they need to start CPR. So to do the chest compressions, you're going to take both hands. Some people will cross their hands like this, and some will lock their fingers. It's personal preference, but both are perfectly acceptable techniques. So you're going to find the person down. You're going to either expose their chest if you can, but you don't have to in order to do this. Right between the center of their chest, which is going to be their sternum, right between the nipple line, that's going to be dead center on the chest, and it's going to be right over the heart, where you can give the most effective compressions. And what you want to do is you want to lock your arms and make sure that you're over the person. That's going to give you good momentum and good force so that you can really have effective compressions. And you're going to push down and up, down and up, down and up. And you're going to do that for continuous until other help arrives. For rescue breathing, what you're going to do is you're going to do 30 compressions, and then you're going to go right over to 2 rescue breaths. You're going to give those 2 breaths 1 second each, over 5 to 6 seconds. So by doing that, you're going to open the airway again. You're going to want to pinch the nose and then make sure that your mouth is covering that person's mouth. And you're going to breathe in just enough to make that chest rise and fall. You don't need to blow a full breath in. Just enough to see that chest rise and fall is more than enough for that person. You're just going to keep continuing that. It is perfectly acceptable to do hands only, which is just compressions for a patient. You do not have to do rescue breathing for them. But it is very important that you continue CPR once it's started until more help arrives. The other thing I'm going to show you here is an AED. This is the AED that we have here at the facility. And you will notice throughout the community, if you're ever at Meijer, Kroger, if you're at a school, public library, that they've got AEDs all over the place. They're all different, but they work the same. So very different, but very similar, very simple and easy to use. They all have instructions that come along with them and a step-by-step picture guide on how to use them. And essentially, like I explained in the presentation, is you're going to turn it on, you're going to let it set itself, and it's going to start giving audible commands, and it will walk you through a step-by-step process and tell you exactly what to do and how to do it. So you're going to turn it on. You're going to, while somebody's doing CPR, someone's going to take 2 gel pads that are already in this package here. Make sure they're plugged in if they're not plugged in already, and they're going to stick them on the body. So I'm going to lift this up for easier demonstration. Is you're going to put 1 pad right here, and you're going to put the other pad over here, and that's going to allow nice electricity to flow to the heart in the areas that we need it to go. Make sure that you remove their clothing before you do that, otherwise it will not be effective for the patient. And then at that point, it will walk you through. It'll tell you analyzing, it'll say continue CPR, it will say stop CPR, it will literally tell you everything to do. So anybody can use an AED. And what I'll do is I'm going to turn this on and kind of give you a quick demonstration as to what it's going to sound like and what the commands are like, aside from me actually putting it on this patient.
Unit, okay. Adult pads. Remove pad package.
That's when you would remove the package from the back of the device and remove the pads out of the package. Once
Cut or
that's
tear
done,
clothing to expose patient's bare chest.
remove the patient's clothing. Make sure that's their bare chest.
Cut or tear clothing to expose patient's bare chest.
So at this point, what it's wanting me to
Unit
do,
powering off.
it's wanting me to apply the pads to this dummy. Unfortunately, this is not a test Zoll, so it will not simulate the entire process. But once the pads are applied to the person, it will go right into the next step of analyzing stop CPR, and then it'll go to shock advised or no shock advised. So the key is to just follow the prompts on the AED, and it will be your resource until paramedics arrive on scene.
Wow, that was so interesting. It's really different to see it in action than to just hear about it. So watching the actual placement of the hands and body for the proper technique for these life-saving procedures, I'm sure it's going to be truly beneficial to so many of our viewers. And we now have questions that have been submitted that we would like to address. And before we get to that, I just wanted to ask, what age, you stated that the AEDs can be found in a school. So what age would be appropriate to use that device on?
So the AEDs, the AED itself can be used for almost any age, even down to small children or infants. The difference is the actual pads. So there are pediatric specific pads and there's also adult pad specific. The difference is you cannot use pediatric pads on an adult because it won't give them the efficient or necessary voltage required for an adult-sized person. But you can use adult pads on a pediatric. And the difference is instead of putting one on the chest and one on the side, is you would put one on the center of their chest and one on the back of the pediatric patient so that it could be used.
Okay, great. Another question that I have. So I know a friend who has a husband who has a defibrillator, and I was wondering, is that something that can be used? The AED can be used with people who have different heart conditions or devices?
So for somebody who has a defibrillator, a simple and easy way, like for a layperson who does not understand or know that person or their history, is when they're feeling the chest, is you will look and feel, and a lot of times you can see a small device underneath the skin. That's a good indicator that that is a AED or a defibrillator, pacemaker, or both. You can still use a defibrillator on patients that has those. The important thing to remember is to not put the pad directly over top of that site, as it will interfere with that defibrillator or pacemaker device for the patient, but it will still give adequate defibrillation if needed. So it is safe to use.
We can't thank you enough for sharing your time and knowledge with us today, Danielle. As a reminder, please go to the McLaren Bay Region Facebook page to view past videos and to learn of upcoming live events that we have. And so thanks again for joining us, and enjoy the rest of your day.